In this question, we have a 36-year-old man. He's been experiencing palpitations for the last 4 hours. He has a past medical history of Wolff Parkinson-White syndrome with 2 prior episodes of SVT. He has no chest pain, shortness of breath, or dizziness. His ECG shows atrial fibrillation at a rate of 170 beats per minute. The question asks, what is the best next step in management? Now, in Wolff Parkinson-White syndrome, we're going to have a accessory pathway that is going to bypass the AV node. So this is important because if we bypass the AV node, then the ventricles are going to receive the electrical impulse beforehand, so they're going to contract much more rapidly. So imagine that this green dot is an accessory pathway, and instead of the depolarization going through the AV node, where it is going to be slowed down, so here's the electrical signals going down and being slowed down by the AV node before reaching the ventricles. With the accessory pathway, we can have these electrical signals reaching the ventricles beforehand. So now that can lead to rapid contraction of the ventricles. So this is important because this can lead to ventricular fibrillation, which can be deadly for patients. Now, atrial fibrillation can occur in up to 10 to 30% of patients with Wolff Parkinson-White syndrome. Atrial fibrillation is going to be the irregular and rapid contraction of the atria. And when a person is in atrial fibrillation who has Wolff Parkinson-White syndrome, this can be even more dangerous because now if the atria is contracting irregularly and rapidly, the ventricles are now going to be at an increased risk of going into ventricular fibrillation. And with ventricular fibrillation, the ventricles are not going to be contracting properly. So instead of contracting, they're basically going to be shaking due to the increase in electrical activity coming at them. So as a result, blood is not going to be going out of the ventricles into the rest of the body, and so that is going to lead to decreased perfusion of the organs, and that can ultimately result in sudden cardiac arrest and death. Now, if a patient has atrial fibrillation who has Wolff Parkinson-White syndrome, we can give them procainamide if they're stable. Procainamide is going to be used to control the rhythm, and a mnemonic that you can use to remember this is that procainamide has this canine sounding word inside. And so remember that canine dogs are going to be from the same biological family as wolves. So this is how you can remember that procainamide is going to be an antiarrhythmic drug that is going to be used to control the rhythm in patients who are in AFib who have Wolff Parkinson-White syndrome. Now, the D in dogs can be used to remember the delta waves on ECG that is found in Wolff Parkinson-White syndrome. So remember the triad that occurs in Wolff Parkinson-White syndrome on the ECG. So we're going to have the delta wave, and we also have a shortened PR interval. This should make sense because PR interval is going to be the time between the atrial depolarization and the ventricular depolarization. And so if we bypass the AV node, then we're going to be shortening the PR interval because the depolarization is going to reach the ventricles much faster than they should. So the time between the atrial depolarization and the ventricular depolarization is going to be shortened. We also have a widened QRS complex, and so that is going to make up the Wolff Parkinson-White triad found on the ECG.